I'm also going to introduce, since we're talking about children and about safety of children as well, I'm very pleased to introduce Catherine Katzen, who is a teacher in Montgomery County Public Schools. She deals with children every day and is very, very much aware of what the special concerns are, the special risks there are. Catherine, there you are. Come on down.
Thank you. The health risks associated with small cell densification and new wireless networks are well documented. Many of you are aware that no U.S. federal government agency has ever reviewed the body of scientific evidence on the health effects of cell towers. Congress defunded the EPA from doing this research back in 1996. While our federal government remains gridlocked, our judicial branch weighed in last summer as the U.S. Court of Appeals for the D.C. Circuit ruled against the FCC's old, outdated cell tower radiation limits. Other bodies here and around the world are sounding the alarm, including the WHO's International Agency for Research on Cancer, the European Parliament, prestigious medical associations and academics, and state governments. These bodies have issued consensus statements recognizing negative health effects of radiofrequency radiation. And the National Toxicology Program, jointly run by the FDA, CDC, and NIH, and based here in Montgomery County, found clear evidence of cancer. Our council members conveniently ignore these facts. I will highlight some of these today, starting with a number of published reviews recommending cell towers be distanced away from homes and schools. In 2020, authors at Michigan Tech wrote in a peer-reviewed paper about the large and growing body of evidence that human exposure to radiofrequency radiation from cellular phone base stations causes negative health effects. The authors recommended restricting antennas near homes and within 500 meters or 1,600 feet of schools and hospitals to protect people, to protect not just people, but companies, to protect companies from future liability. 1,600 feet, that's over 50 times greater distance than what Councilmember Reamer is pushing in ZTA 2201. A 10-year study published in Science of the Total Environment on cell phone antennas found a clearly elevated relative risk of cancer mortality at residential distances of 1,600 feet or less from cell phone towers. A review published in the International Journal of Occupational Environmental Health found that people living less than 1,600 feet from base station antennas had increased adverse neurobehavioral symptoms and cancer in 8 of the 10 epidemiological studies. A study commissioned by a state government in Austria found a significant cancer influence in the area around transmitters, as well as significant exposure-effect relationships between radiofrequency radiation exposure and the incidence of breast cancers and brain tumors. These harms are compounded in children who have smaller heads than adults. Cell phone and wireless radiation can go deeper into their brains because children have a shorter distance from their skull to their brain center. Research shows that children can absorb up to 10 times the radiation in the bone marrow of their skulls than adults. According to the American Academy of Pediatrics, who in 2012 and 2013 called on the FCC chairman and commissioners to review its RF guidelines, children are not little adults and are disproportionately impacted by all environmental exposures, including cell phone radiation. Current FCC standards do not account for the unique vulnerability and use patterns specific to pregnant women and children. It is essential that any new standard for cell phones or other wireless devices be based on protecting the youngest and most vulnerable populations to ensure they are safeguarded throughout their lifetimes. In 2011, radiofrequency radiation was classified as a Class 2B possible carcinogen by the World Health Organization's International Agency for Research on Cancer. Since 2011, the published peer-reviewed scientific evidence associating RFR to cancer and other effects has significantly increased. In 2019, the WHO IARC Advisory Committee recommended that radiofrequency radiation be reevaluated as a high priority in light of the new research. Currently, several scientists conclude that the weight of current peer-reviewed evidence supports the conclusion that radiofrequency radiation is a proven human carcinogen. The European Parliament released a report in July 2021 concluding that commonly used RFR frequencies are probably carcinogenic for humans and clearly affect male fertility, with possible adverse effects on the development of embryos, fetuses, and newborns. A review published in Experimental Oncology found alarming epidemiological and experimental data on possible carcinogenic effects of long-term exposure to low-intensity microwave radiation. Even a year of operation of a powerful base transmitting station for mobile communication reportedly resulted in a dramatic increase of cancer incidence among the population living nearby. An analysis of 100 studies published in environmental reviews found that approximately 80% showed biological effects near towers. According to author Dr. Blake Lovett, as a general guideline, cell base stations should not be located less than 1,500 feet from the population. A large-scale animal study published in Environmental Research found rats exposed to cell tower emission RF levels had elevated cancers, the very same cancers also found in the U.S. National Toxicology Program animal study of cell phone RF. A study published in Electromagnetic Biology and Medicine found changes in blood considered biomarkers predictive of cancer in people living less than 260 feet from cell antenna arrays. A study published in the International Journal of Environmental Research and Public Health found higher exposure to cell arrays linked to higher mortality from all cancer, and specifically lung and breast cancer. There is no legal or practical reason to pass ZTA 2201. In contrast, there is strong scientific evidence and a moral imperative to oppose this ZTA.
Thank you, Catherine. This is an example of why Montgomery County has one of the finest school districts in the United States. Thank you very much for all you do.